Pregnant with fibroid, our miracle after infertility. Have you ever been told that getting pregnant might be difficult because of fibroids? Have you spent months or even years trying to conceive, wondering if motherhood would ever become a reality? Hello and welcome to Joburg Fertility Center. I'm Dr. J.E. Muloi. At Joburg Fertility Center, we are dedicated to turning dreams of parenthood into reality. As leaders in the advanced reproductive care, we provide cutting-edge fertility treatment tailored to each patient's journey. Today, we are sharing an inspiring story of hope, resilience, and possibility of achieving pregnancy despite fibroids and infertility challenges. If you have been diagnosed with fibroids and struggling to conceive, this story may remind you that your journey is not over. Stay with us until the end because we will also discuss how fibroid affect fertility and what treatment option may help you achieve your dream of becoming a parent. Understanding fibroid and infertility. Before we share this remarkable journey, let's first understand what fibroids are. Fibroids are non-cancerous growths that develop in or around the uterus. They can vary greatly in size from a tiny growth to that cannot be seen with the naked eye to a large mass that can change the shape and size of the uterus. Many women with fibroid experience symptoms such as heavy menstrual bleeding, pelvic pain or pressure, frequent urination, pain during intercourse, lower back pain. However, some women may not experience any symptoms at all, while many women with fibroid successfully conceive naturally. Certain fibroids can interfere with fertility by affecting the shape of the uterus, blocking the fallopian tubes, or preventing an embryo from implanting properly. The struggle with infertility. For this couple, the dream of having a baby seemed increasingly distant. Month after month, they watched pregnancy tests come back negative. Friends and family members announced pregnancies while silently battled disappointments and heartbreak. After trying to conceive for several years, they decide to seek professional help. During fertility investigations, doctors discover multiple fibroids within the uterus. The diagnosis answered many questions, but it also raised new concerns. Could the fibroid be preventing pregnancy? Would treatment be successful? Would they ever become parents? These are questions that many couples facing infertility ask themselves every day. The next step was developing a personalized treatment plan. Not all fibroids require treatment. The decision depends on the several factors, which include the size of the fibroid, the location of the fibroid, the symptoms they cause, the impact on infertility. After thorough evaluation, the medical team determined that fibroids were likely affecting the ability to conceive. Treatment was recommended to improve the chances of pregnancy. For some women, treatment may involve medication to manage symptoms. For others, surgical removal of fibroids, known as a myomectomy, may be the best option. The goal is always to preserve fertility while improving reproductive outcome. Recovery process. Following treatment, recovery required patience. Like many women who undergo fertility related procedures, there were moments of uncertainty. Questions filled their mind. Would the treatment work? Would pregnancy finally happen? The waiting period can often feel like one of the most difficult part of the fertility journey. But recovery also brought hope. The couple remained committed to their dream and continue working closely with fertility specialists. They followed medical advice, attended follow up appointments, and maintained a positive outlook despite the challenges. The miracle they had been waiting for. Then came the moment they had dreamed about for years. A pregnancy test finally showed a positive result. After years of disappointment and uncertainty, they were pregnant. The emotions were overwhelming: joy, relief, gratitude, excitement for the future. For many couples who have struggled with infertility, that positive pregnancy test represents much more than two lines on a stick. It represents perseverance, courage, and hope. It is a proof that even after years of challenges, a new chapter can begin. Pregnancy with fibroids, what to expect. Many women wonder whether it is possible to have healthy pregnancy after fibroid treatment. The good news is that many women go on to experience successful pregnancy and healthy deliveries. However, every pregnancy is unique. Women who have fibroids or history of fibroids may require closer monitoring throughout pregnancy. Healthcare providers will monitor the growth of the baby, the size of any remaining fibroids, placental position, overall pregnancy health. Regular, regular prenatal care plays a critical role in ensuring the best possible outcome for both mother and the baby. What this story means for you. If you are currently struggling with infertility and fibroids, this story carries an important message. Do not lose hope. A fibroid diagnosis does not automatically mean you cannot become pregnant. Advances in fertility care and reproductive medicine have helped countless women to achieve successful pregnancies. The key is obtained in accurate diagnosis and receiving individualized treatment from experienced fertility specialists. Every fertility journey is different, and what works for one person may not be appropriate for another. This is why expert evaluation is so important. When should you seek help? You should consider consulting a fertility specialist if one, you have been trying to conceive for 12 months without success. You have ever, two, you are over the age of 35 and have been trying for 6 months. You have known fibroids, you are experience heavy or painful periods, you have you have had recurrent pregnancy loss, you have concern over your fertility. Early assessment can help identify potential obstacles and improve your chances of successful treatment. Your journey from infertility to pregnancy can be filled with challenges, uncertainty, and emotional up and downs. But stories like this remind us that hope is always possible. Fibroid may create obstacles, but they do not always define your future. With the right diagnosis, expect care, and personalized treatment plan, many women can overcome fertility challenges and achieve their dream of becoming parents. Your miracle story may still be waiting to be written. If you have fibroid and you're struggling to conceive, do not wait to get the answers you need. Contact us at Joburg Fertility Center and let us help you find a solution to your fertility challenges. We are dedicated to providing personalized fertility care and guiding you every step of the way on your journey to parenthood. Thank you for watching. If you have found this video helpful, please like, share, and subscribe to our channel for more fertility education, patient success stories, and expert reproductive health advice. We look forward to help you take the next step toward growing your family. Thank you. Thank you.